That close to 20 million children in the world are not receiving the vaccines they need. Well, more than 6% of this number is actually here in Nigeria and are missing out on vital vaccines during adolescence, adulthood and into old age. Well, this is according to the United Nations Children's Fund as the World Immunization Week is marked globally. The Unicef Immunization Week is aimed at promoting the use of vaccines to promote people of all ages against diseases and protect them. Well, millions of lives are saved every year through immunization, which is recorded as one of the world's most successful health interventions. The theme for the 2022 World Immunization Week is hashtag Long Life for All, reflecting the importance of lifespan vaccination and for all, reflecting the importance of vaccine equity. And to discuss this and more, let's now bring in the doctor, we like to call him, Eduardo Blanco. He is the United Nations Children's Fund's Unicef Nigerian Chief of Health. Thank you so much, Eduardo, for being here. Even though there are troubling statistics about vaccines around the world and here in Nigeria, but I want to talk about Ukraine. Earlier on, we saw the president of Ukraine, Zelensky, speak about how devastating the war has been. Well, you at UNICEF, how worried are you about the reports we're seeing about children in particularly being caught in the crossfire?
Right. I mean, vaccines are the opposite, the contrary of war, right? War kills people. Vaccines is what we do best, to love others, in this case our next generation, our daughters, our sons. When there is war, there is many children that don't have access to health, right? To vaccines, to water, to food. And this is normally going to become an outbreak, measles outbreaks, yellow fever outbreaks, etc. And the best way of preventing it is with vaccines. So we as UNICEF, actually, we are working as well in Ukraine and the neighboring countries to ensure that children can be vaccinated.
Oh, that's incredible to hear. So let's go back home to Nigeria. 20 million children and 6% in Nigeria. And talking about diseases that are preventable when you talk about if you're fully immunized. How much would you say COVID-19, exacerbated the situation that we're seeing this low vaccination as reported by you in Nigeria?
Right. One of the big problems that we have here in Nigeria is the inequities, right? It's not in all the states we have the same percentage of children vaccinated. In the southeast, for example, for BCG, for tuberculosis, it's 90% of the children. In the northwest, it's only 60%. In places like in Sokoto, it's about 11% of the children they have been vaccinated. So there are big inequities. At this moment, in the world, we have about 25 vaccines that work. Here in Nigeria, we have 14 of them. Right, COVID has been the 15th vaccine that arrived to the country. It's for adults. People are not maybe, there are some reluctance, there are some hesitancy about COVID-19 vaccine. We're working on that. We are trying to get what you can do for others, if you care, if you have love, is to vaccinate yourself. This is how you show to others that you're part of the community, that you take care, that you pass your love to others. So we're trying to pass this message, especially this week, there is the World Immunization Week, and to really increase the numbers. We are vaccinating now, for example, only for COVID, 6 million Nigerians are getting vaccinated every month. That's quite remarkable. Already 25 million Nigerians, they already got at least one dose for COVID-19. However, only less than 1 million, they got 3 doses, the booster.
Yeah.
So this is still a lot of things to do.
Absolutely. I'm one of the 1 million, by the way, because I don't play with my health. I did get my booster a couple of months ago. But let's talk about this rise of infectious disease that experts are actually saying they're seeing more and more, especially in adults, because probably some of the vaccines they were inoculated with as children might have worn out. Talk to us about that and what you're doing as UNICEF to ensure that we're seeing more lifelong vaccines being given to the Nigerian child for lifelong protection.
Right, we are seeing now, for example, a massive measles outbreak that we're trying to contain with vaccination, right? Or we have as well the polio variant that now has been since 2 years ago going around here in Nigeria. So we need to ensure that really the children, they have the access to the vaccines that they need. We have 14 antigens now of vaccines. We are bringing to the country almost 300 million vaccines per year. But this needs to be translated from ports to arms of people, right? So this is what we are trying to do, and jointly with the Federal Ministry of Health, National Primary Health Care Development Agency and others, to really ensure that all children, the ones living in the slums in Lagos, the ones in Sokoto, the ones in Borno, Maiduguri, etc., they have access to the vaccines that they need.
Right, and I know that one thing that the Primary Healthcare Development Agency did introduce some time ago is the approach of getting the entire family vaccinated. As you're going for your COVID jabs, you get your children along with you, get them routinely immunized. And Nigeria's vaccination has been, tagged as fair. It's been rated as being fair. You as an expert, serving under Unicef, you are a doctor yourself. What more do you think Nigeria needs to do? Yes, we're seeing the immunization really improve, but there's still room for improvement, you must agree. So what do we need to do to fill in those gaps to ensure improvement?
Yes, and indeed, what we saw is like in the last 2 years, the improvement was less, likely because of COVID and other things. I think the cornerstone to improve is to strengthen the primary health care. People, the first contact with the healthcare is not a tertiary hospital or a fancy hospital or a university hospital. It's the primary healthcare. It's the health center that they have close to them. They work with nurses, with midwives. This is the people that we need to strengthen, to have more nurses, more midwives, more human resources, a stronger primary health care. And if we get that, we can really increase the numbers. As you said at the beginning, we have more than 2 million children here in Nigeria that they don't have a single shot of vaccines. I mean, this is normally, you consider that when you get at the 6 weeks, the first Penta-1 vaccine, so we really need to change that. And we can. I am really optimistic and I really believe that we can do it, but we need to invest more in vaccines, to invest more in human resources, in doctors, nurses, etc., and to really have a strong primary healthcare system.
Okay, well, that is all important. I do know that vaccines come into this country and sometimes they expire before they get into the arms of people because maybe not enough people are going out there to go get jabbed. I'm not just speaking about COVID-19 now. You as a professional who's on the field, what are some of the challenges that you have, found out as to the reason why people are not getting immunized?
Yes, one clearly is access, right? To have access to the health facility. Many people, they still live far away from the health centers, etc. So we are trying to work with that, doing outreach, so to get closer to the people, including in urban slums. Other one as well is vaccine hesitance. And what we are doing is to working with communities, working with traditional leaders, with religious leaders, and trying to pass this message. We can, if you really care about others, if you really love your children, if you really love your partner, your family, you really need to get vaccinated. And we really hope that we can pass this message. And hopefully thanks to you today as well.
Yes, we need to pass this message because when you actually inoculate a child, you protect them, especially from diseases that are preventable. But some diseases, though, once you get vaccinated, you don't have to think about it for the rest of your life. But we still have some of such in Nigeria. Yellow fever, for instance, is still a major challenge. So what role would you say the part of hygiene and sanitation really plays in ensuring, prevention in the first place of some of the outbreaks that Nigeria is currently bedeviled by?
Of course, I mean, vaccines are a very powerful tool, but it's not the only tool and cannot be done alone, right? And as you said, like hygiene, water, public goods, public works, all of this is needed to really be able to stop some of these diseases. The good news as well, the government is going to introduce very soon new vaccines into the country, like rotavirus to avoid diarrhea. So this is going to be a fantastic news. And if we do this at the same time that we have more water, more hygiene, etc., we can really beat diarrhea as one of the major causes of mortality here in Nigeria for children.
So what you're just telling us, okay, we need to confirm that. I'm a mother, so I know what that means. Rotavirus will now be added to routine immunization
this
in
year,
for free.
Before the end of the year.
Thank you so much, Eduardo Blanco, for that news and also for coming tonight on the program. And thank you so much for all the work that you're doing in Nigeria and Africa in general. We really appreciated saving our children from UNICEF. Thank you so much for being here.